As we predicted, this flu season has hit early and it's hit us hard. So we are seeing high and very high rates of influenza across the country. We really recommend everyone get their flu vaccine this season. Anyone over 6 months of age is eligible. And from the data that we're seeing, the flu vaccine this year is a good match for the circulating strains that we have seen early in this flu season. And it's not too late. It's important to remember that it takes about 2 weeks after you get your flu vaccine for you to have the full protection from it. The really challenging thing this respiratory virus season has been the circulation of these 3 respiratory viruses at the same time: RSV, influenza, and COVID-19. We have seen, especially amongst children, increasing rates of hospitalizations, and many hospitals and healthcare systems being very stretched because of the large volume of children who are seeking care in clinics, emergency departments, and who are requiring hospitalization for management of these infections. Number 1, get your flu vaccine, get your COVID vaccines. Many people are eligible for the bivalent boosters as well. So if you're not sure, reach out to your healthcare provider and see if you're eligible for that. Wear a mask. I know many people have kind of put their masks away after vaccines came out, and now's the time to dust them off and start wearing them again. The mask protects against COVID-19, but also these other respiratory viruses that we're seeing circulate. And for people who are high risk or who may be around people who are high risk, it's especially important to go back to wearing masks in any indoor space where you're around other people. This is also true for traveling. So if you're in airports, on airplanes, taking a train or taking a bus, these are other opportunities to wear a mask to help reduce your risk of getting infected and your risk of spreading infections to others. If you're planning to attend holiday gatherings, testing before you attend for COVID-19 is another good thing you can do to help reduce the risk for anyone that may be at the gathering. If you're feeling sick, we would say don't attend any gathering because even if your COVID-19 test is negative, you could have one of these other viruses, and so you're still at risk for making other people sick.